Hey folks, Dr. Jeff Williams, Creekstone Integrated Care right here in Amarillo, Texas. You know, there's no doubt in my mind that the majority of headaches could be kicked to the curb if the right treatment were used from the start. It may be simply anecdotal experience, but it's still personal experience nonetheless. And personal experience has shown me time and time again that chiropractic manipulation is highly effective in treating headaches. Certainly specific types of headaches, like tension headaches and cervicogenic headaches, they respond extremely well to chiropractic treatment. There's just no way around it at all. And in fact, my own guesstimate from over 19 years of experience is that about 80% of headaches, they respond very well. 10% get better but don't go away completely. And only about 10% or so can't be treated with chiropractic. Now those are pretty solid odds, right? If you're having debilitating headaches of any kind, I'll take those odds. If someone said they could give me an 80% probability of something happening, I'd probably bet money on it. So we're going to go into some new research here on headaches and how they respond to chiropractic manipulation. So here's why they did this research. There are really two thought processes when it comes to conservative treatment of headaches. One is chiropractic manipulation, also commonly called the adjustment or popping. Then there's the term in traditional medical field called mobilization. With mobilization, they commonly add exercises to the treatment protocol. So there's been no studies directly comparing the two types of treatment to each other in terms of their effectiveness. The authors in this study, they wanted to test which was the better regimen for cervicogenic headaches specifically. Now, cervicogenic means originating from the neck area. So here's how they did the research. 110 people suffering from cervicogenic headaches participated. The 110 participants, they were randomly placed into either a manipulation group or a mobilization group. The outcome or result was measured by the numeric pain rating scale. The headache frequency, duration, and disability were measured as well using the Neck Disability Index, the medication intake, and a survey called Global Rating of Change. The treatment lasted 4 weeks, and patients were assessed at a follow-up appointment 1 week after the end of treatment, and then again 4 weeks after the end of treatment, and then a final time at 3 months after the end of the treatment. Now here's what they found. Those in the chiropractic manipulation group showed significantly less intensity in their headache symptoms than did the other group that only had the mobilization and exercise. Well, that's a big deal. The patients in the chiropractic manipulation group also had significantly less frequency of the headache symptoms. That's a big deal. Not only did the outcomes show manipulation to be superior, but patients in the chiropractic manipulation group also felt greater improvement themselves based on their self-reports. So not only did the research prove that chiropractic was the superior treatment, but the patients also felt like it was the better treatment. So let's wrap it up. To quote the author's conclusion, they said 6 to 8 sessions of upper cervical and upper thoracic, which is the top of your mid-back. So 6 to 8 sessions of upper cervical and upper thoracic manipulation were shown to be more effective than mobilization and exercise in patients with cervicogenic headaches. And the effects were maintained at 3 months. A big deal. Isn't it nice to not just have to take my word for it? It's nice to have some research, isn't it? And this isn't the only research showing our effectiveness for headaches. I've made several videos and blogs on this very topic where I highlight research papers showing how powerful chiropractic really is. This one is just the latest. I hope you enjoyed this week's video and this research. I hope you learned something from it, and will then turn around and share it with your friends and family so that they can learn something too. Educating my market where I live and where I work and where I raise my family, that's important to me. Educating my market on what we do, why we do it, and how powerful it can be is the only way to know that everyone that needs to be seeing a chiropractor is actually seeing one. It's the patients that never go to a chiropractor because they heard we can't help them. Now, those are the ones that bug me because they didn't know any better. Help me make sure that doesn't happen. Share this video, share the information so that we can help make a difference for everybody. Subscribe to our YouTube channel so that you don't miss any important information that we pass along, and we'll see you next time.